Now, on first glance, this sounds great, legally requiring doctors to perform sterilization for patients who desire it, no matter how old they are, to their marital status, or how many children they've had. But even as an OBGYN who created a list of 3,000 gynecologists who believe in just that, I don't like this piece of legislation because the devil is in the details here. And just like I don't like the state telling me what I can't do for my patients and their reproductive system, I don't like legislation that tells me what to do without any discussion of the nuances involved in medical decision making. So, this is new legislation coming out of the state of New Hampshire, and it's called the Right to Appropriate Reproductive Care for Medical Conditions. And it says that for any patient who's 18 years or older who has a medical condition for which a medical advisable course of treatment include a procedure that leaves them sterile, they may not be denied this procedure just based on the fact that they are young or don't have children. Okay, that sounds good. I have no problem with that. Then it says that the medical condition is any medical condition or syndrome related to the reproductive system, and that appropriate medical care includes a hysterectomy, an oophorectomy, a salpingectomy, or an ablation, and that a patient who's been denied what is deemed to be appropriate reproductive care, that doctor will be reported to the medical board. The problem here is who is determining if it is appropriate medical care prior to going to this point. My fear is that patients who have decided they want a certain type of treatment will be upset when they're denied that, even though medically they don't need it. Because this piece of legislation isn't what I initially thought it was going to be. I thought this was for patients who wanted their fallopian tubes removed for sterilization, which is almost always an elective procedure. But this isn't about that at all, actually. This is about people who have medical conditions that are being denied what they think is the right course of treatment for their medical condition. But the doctor is also allowed to make medical decisions and is allowed to say, hey, a hysterectomy, a big surgery, that has a lot of risks involved with it, is not the treatment for the condition that you have. I also take issue with the fact that sometimes the doctor that you're seeing is not the right doctor for you. So even if you were someone who was desiring sterilization just by fallopian tube removal, if you saw a doctor who did not feel comfortably surgically performing that on you for whatever reason, it could be from the patient side or the surgeon side, now they're going to be reported to the medical board. I think it would have been nice if it had included a requirement that you refer your patients to another doctor. That makes sense. But just to say, if you deny someone sterilization, you get reported to the medical board without any nuances involved in that discussion, that just sounds like a lot of confusion and a waste of time for a lot of people. I think the goals of this legislation are great. We should be removing the paternalistic nature of medicine, especially when it comes to reproductive care. I just don't think that this is the right way to go about it.